Thank you.
شكرا يا دكتورة. هنختم بالدكتورة هبة حمزة والدكتورة سلمى جمال هيكلمونا عن السودو بارتر سيندروم ان سيستيك فايبروس. مش موجودة؟ تمام تمام. اهلا يا دكتورة سلمى.
Thank you, my dear professor, for the kind introduction. I'm Salma Abdelhady. I'm a lecturer of pediatric respiratory medicine. Our topic today is about pseudo Barter syndrome in cystic fibrosis patient, an increasingly reported presentation that is usually missed. First, I would like to thank my dear professor, Dr. Imam Fouda and Dr. Tarwat Daraz for inviting me to give this talk. Let's first talk about what is Barter syndrome. Barter syndrome is a general term of a group of genetic disorders in which there are specific defects in kidney function. These defects impairs the kidney's ability to reabsorb salt and causes imbalance in various electrolyte and fluid concentrations with subsequent hypokalemic, hypochloremic metabolic alkalosis. Pseudo Barter syndrome has the same biochemical properties as Barter syndrome in the absence of renal tubular pathology. حابة بس أوضح الجزء ده. البارتر سيندروم مشكلته ان البيشنت بيلوز الالكترولايتس بتاعته في اليورين، انما سودو بارتر سيندروم بيلوز الالكترولايتس عن طريق حاجه ثانيه هنتكلم عليها دلوقتي في السي اف بيشنت. طيب ليه بيحصل سودو بارتر سيندروم in cystic fibrosis؟ Electrolyte disturbances are common in CF patients due to excessive salt losses in the sweat, especially during the summer. Pseudo Barter syndrome has been reported with cystic fibrosis, and the disturbance of serum electrolytes is due to their excretion through a non-kidney source, which is the sweat. Pseudo Barter syndrome associated with CF is often misdiagnosed as Barter syndrome or as simple dehydration. It commonly presents as recurrent episodes of dehydration with metabolic alkalosis in infancy, particularly in hot weather. يبقى لو جالي البيشنت ده جاي اكتر في فصل الصيف والبيشنت ده presented بديهايدريشن وعنده metabolic alkalosis، يبقى ممكن افكر ان البيشنت ده ممكن يكون CF، بالذات لو عنده other signs زي failure to thrive او اي pulmonary symptoms. Okay, how common is this presentation? Overall, pseudo Barter syndrome is considered as a rare presentation in infants and children with CF. However, there are increasing number of reports of this peculiar presentation in CF patients, and some reports pointed that it was the first presentation in many cases. Do you really see such presentation at the pediatric pulmonology clinic? Yes, actually, we have plenty of cases who were presented with pseudo Barter syndrome. Around 38 of the CF cases follow-up at our clinic had the presentation of pseudo Barter syndrome during the course of illness. Most of the patients were infants below 1 year of age. Pseudo Barter syndrome can present with dehydration without any respiratory manifestations. Many cases were presented with repeated attacks of dehydration associated with metabolic alkalosis. Most of them had notable failure to thrive, which required further investigations leading to CF diagnosis. Others followed up at the nephrology department at first, then referred for possible CF diagnosis after exclusion of renal tubular pathology. Other patients presented with pseudo Barter syndrome with respiratory manifestations, and most of these patients, their pseudo Barter presentation improved after the age of 1 year. Pseudo Barter syndrome is now considered as one of the manifestations of CFTR protein dysfunction, and many cases who carry rare mutations in the CF transmembrane conductance regulator gene present with pseudo Barter syndrome. I will go through a case presentation very quickly. A 6-month-old male twins presented to our unit with history of recurrent events of dehydration. They were also presented with RD grade 2 moderate dehydration and failure to thrive. Their blood gases showed metabolic alkalosis, hypokalemia, hyponatremia, and hypochloremia. Further investigations excluded any underlying renal pathology. That is the VBG on presentation. Sweat chloride test was positive for both cases, and Pseudo Barter Syndrome presentation improved on correction of dehydration and salt replacement. So my recommendation at the end of this lecture, CF diagnosis should be considered in infants presenting with dehydration, salt depletion, and metabolic alkalosis. Thorough assessment of these infants is mandatory to look for other CF red flags, and further testing should be arranged as necessary. Thank you.
احنا كده خلصنا الساينتفك داي. سعداء ان انتوا صبرتوا معانا لغايه الاخر. لسه عندنا سحب على 4 جوائز. والله يا فندم 4 او كوني 4 بس يا امل. والله اتفلتروا في السكه. اتفلتروا في السكه كويس. وبعدين
دكتوره ايمان
هناخد صوره جماعيه.
عايزين ننهي الجلسه بتاعتنا وبنشكرك جدا على المؤتمر الجميل وكل الاساتذه اللي شاركوا. دكتور ثروت والله فعلا يوم ممتع وجميل، وكل الناس اللي اتكلموا كان كلام رائع وجميل، ويا رب يتكرر ان شاء الله ويبقى في فايده للعيانين وفايده لينا كلنا. وشكرا.
بنشكر حضراتكم جميعا طبعا، يعني كلكم نورتونا وكل حضراتكم طيبين، وان شاء الله مؤتمرنا ان شاء الله القادم هيبقى 22 مايو باذن الله بعد شهر رمضان. كل سنه وانتم طيبين.
دكتور ثروت، دكتور ايمان، انا بس احب اقول حاجه. بنشكركم، نشكر من اول دكتور كريمه، دكتور ماجده، دكتور ثروت، دكتور ايمان، دكتوره اسماء، تريز حبيبتي ربنا يجيبها بالسلامه، دكتور سالي، كل الفريق. الفريق رهيب، وكلامهم they are scientific, they are polite, they are sincere. وانا بشكر لحضراتكم مجهودكم اللي خلى ان شاء الله تشوفوا يعني فريق زي ده قد ايه بعد كده هيبقى ما شاء الله، يعني يقر عينكم وقلبكم بتعليمكم واجتهادكم. فيعني فريق التشيست فريق انسبايرنج وقوي وسنسير ومش شوي.
بس يا ميرفت والله، وشكرا جزيلا استاذ الدكتور محمد عبد الرازق، استاذ الدكتوره هدى، استاذ الدكتوره دينا، استاذ الدكتوره سالي، استاذ الدكتور صومت معانا من الصبح، استاذ الدكتوره ميرفت. الحقيقه انا سعيده جدا جدا بوجودكم.